Are you aware that symptoms of chest pain and shortness of breath are not necessarily due to a heart attack? Have you ever heard of the condition called myocarditis? Hello everyone, I'm Dr. Nadine Gauthier, cardiologist at the Ottawa Hospital. Today, I would like to shed some light on a not-so-common heart condition, myocarditis. It is a serious and potentially lethal heart condition that most people are not so familiar with. So let's dive in. What is myocarditis? Myocarditis is the condition causing inflammation of the heart muscle. It can present in various forms or severity. The inflammation of the myocardium, or heart muscle, impedes on how well the heart can pump blood and provide proper oxygen to the rest of the organs and muscles of the body. Myocarditis is most frequently triggered by a virus, such as viruses responsible for your common cold or flu, or even gastroenteritis. Less commonly, autoimmune conditions can also be linked to this condition. Myocarditis can also be caused by certain medications or exposure to toxic substances, such as chemotherapy agents, and rarely by illicit substances such as cocaine or MDMA. Symptoms of myocarditis can differ from one person to the next. Milder cases present with flu-like symptoms such as headache, fever, chills, sore throat, or joint pain. Cardiac symptoms may eventually manifest, such as chest tightness and shortness of breath. More acute cases might present with severe symptoms of chest pain, a fast or irregular heartbeat, trouble breathing, swollen legs, and fatigue. It is important to note that not everyone will present with all of these symptoms. Diagnosing myocarditis can be difficult because the symptoms can look like other heart problems, such as angina, heart attack, or heart failure. Usually, your physician would do a full checkup, including tests like an electrocardiogram or ECG, and blood tests to check a specific heart enzyme called troponin, which is a marker of heart strain. An echocardiogram, which is a heart ultrasound, is also very important to get a closer look at the strength of the heart muscle, which is often weakened in myocarditis. A cardiac MRI is also commonly done to make the final diagnosis of myocarditis. Rarely, in extreme cases, a heart biopsy may be indicated to make the final diagnosis. The goal is to rule out other life-threatening conditions, such as a heart attack and cardiomyopathy, which means weak heart muscle. Often, myocarditis will improve naturally with time and some TLC. Rest and hydration are crucial to allow the heart to heal. It may take days to months for the inflammation of the heart to reverse, but if things don't improve, or if the symptoms get worse, doctors may prescribe heart medications to help manage symptoms and to ensure proper heart function. In severe cases, a pacemaker may be required, or when there is severe weakening of the heart muscle and the body remains in shock, a mechanical heart and heart transplant may be offered. Overall, myocarditis can be a difficult diagnosis to make, but the silver lining is that most of the time it improves on its own with a bit of rest and care. If you are experiencing symptoms of shortness of breath and chest pain after a viral illness, that could be myocarditis. It would then be important to seek medical attention. Getting checked out early can help ensure you get the right diagnosis and treatment. It's true that myocarditis can be a very serious condition, but most cases are mild and completely reversible. It is important to understand the main causes and recognize the symptoms early in order to get proper care in a timely fashion. More importantly, once it is diagnosed, myocarditis can be easily treated in most cases, and people can return to an active, heart-healthy life. I hope you found the information in this video helpful. I'm Dr. Nadine Gauthier. Thank you for watching.